Hello guys, welcome back to my YouTube channel. From this video, I'm going to discuss about the importance of blood sugar control. So let's get going. First, we have to understand what is the normal blood sugar level control mechanism in our body. What is glucose? Glucose means the simplest form of carbohydrate that we eat or drink. That means these carbohydrates break up into small pieces in our digestive system, and then what happens is this glucose enters into our bloodstream. When this glucose enters into our bloodstream, it stimulates the pancreas to secrete insulin. Insulin is a hormone which regulates the blood glucose levels in our body. Actually, it is an endogenous hormone which is secreted in our body. So, in the diabetic patients, what happens is in type 1 diabetes, there is absolute insulin deficiency. In those patients, there is no insulin at all. So, they have to take insulin from outside. Type 2 diabetes patients, what happens is there is insulin resistance. That means, although insulin is present in their body cannot utilize that insulin in their body. So, they have to take medications to improve the insulin resistance. The normal blood sugar levels in our body is 70 to 99 milligrams per deciliter. If it is below than this 70 milligrams per deciliter, we call this as hypoglycemia, and if it is higher than 99 milligrams per deciliter, we call it as hyperglycemia. There are several consequences which occurs if you are not control your blood sugar levels within normal range. So we have to concern about your blood sugar levels to keep within the normal range. Let's see what is hypoglycemia or low blood sugar levels. When a person produces too much insulin, or when the person gets too much medications or too much oral hypoglycemic drugs, it can cause low blood sugar levels. Blood sugar between 54 to 69 milligrams per deciliter is considered as hypoglycemia. The typical symptoms are the dizziness, irregular or fast heartbeat, hunger, sweating, anxiety, irritability, and shakiness. Some people may feel symptoms above 70 milligrams per deciliter, while others do not feel symptoms until the levels even low. There is a thing called as level 2 hypoglycemia, which is considered the blood glucose levels below 54 milligrams per deciliter. This leads to more severe symptoms such as confusion, abnormal behavior, blurred vision, because at this point the brain may not get in enough glucose to function. When glucose gets too low, this can lead to a person falling, having seizures, or passing out. Level 3 hypoglycemia is when person cannot think clearly or may have passed out and needs assistance of another person, and this response is not defined by a specific glucose value. Here also you can see the symptoms of hypoglycemia: shaking or trembling. The patient may feel faster heartbeat, extreme hunger, sweating, confusion or difficulty in concentrating, and the dizziness. Here also the same picture, same symptoms. And then you have to know what is hyperglycemia or high blood sugar levels. When a person does not get enough insulin or medication to meet their body's demands, it can lead to high blood sugar or hyperglycemia. There are many causes of hyperglycemia, including untreated diabetes mellitus, not getting enough medication, eating too many carbohydrates, being less physically active, having excess weight gain, and genetic factors. Typical symptoms of high blood sugar levels include extreme thirst, the need of urinate often, that means polyuria, blurring of vision, increased hunger, feeling tired or weak, headache. Other symptoms can be severe and could include vomiting, confusion, shortness of breath, and coma. Some symptoms of low blood sugar and high blood sugar can be similar, like blurring of vision and drowsiness. Therefore, it is important to check your blood sugar levels before treating. So, let's see what is the importance of monitoring blood glucose levels. Monitoring blood sugar helps to determine if you are meeting your glucose targets, which helps to reduce unpleasant symptoms of high and low blood sugar levels. And it is important to avoid long-term diabetic complications as well. It is helpful to remember that the numbers are neither good or bad. They are simply information used to help learn what is working well and identify areas for important in your diabetic management as well. Blood sugar monitoring is important because your HbA1c levels are only done every 3 to 6 months and it reflects an average. If someone with HbA1c in target could still have a lot of high and low blood sugar readings. That's There are so many complications that a diabetic patient can develop. So you have to maintain the blood sugar level